The advice and opinions expressed by Dr. Grant-Pichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grant-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grant-Pichet.
Dr. Grant-Pichet.
Dr. Doreen Grant-Pichet.
Dr. Doreen Grant-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Two that are about nystatin, so I'm going to cover both of them. Anisha wrote, how long does nystatin die-off last? We are 2 weeks in, still very difficult.
Oh, interesting.
Should expectations be managed during ABA sessions? But we also had someone write in and say, we have started our biomed journey with our 3-year-old son using MedMap's doctor. He is being treated with nystatin for yeast and seems to have taken a step back. We're presuming it's die-off. Our BCBA didn't seem to think much about biomed in general, but otherwise we really like them. You're changing that.
I don't know. I've been trying to change that for years, and I just don't know if I can't
You
keep
have
up.
made inroads. I am promising you, you have made inroads.
Thank
Because I
you.
see a difference when I'm talking to BCBAs now where they're like, okay, that's a thing, and I want to pay more attention, and I want to know more about it. Where before, they always used to be like, not my thing, I don't care, I don't want to know, it's not. And you would go, you're treating a person.
Yeah, and our newsletter this week is all about biomedical stuff that interferes with behavior, interacts with behavior.
Of course.
But this is, so nystatin, actually I'm kind of surprised to be honest, because nystatin is one of the, I don't want to say weakest of the antifungals. It's not a very, very strong antifungal at all. In fact, it's so not strong that it can be used with newborns. Right? I mean, it is the medication that we give when an infant has thrush, which is the white fungus inside your mouth.
Yeah.
And they give nystatin. So it's kind of like, it's amazing to me that you're having such a strong reaction to it. You should continue, and every child is different. It might not be working if it's dragging on too long. Talk to your doctor. There are stronger antifungals, depending on your child's age, that can be given. Also don't know what signs of yeast you're seeing. They give you different things for different yeast infections, or, what are you seeing? There's lots of other choices, Nizoral, diflucan, there's other things you can try as well. It does take a little while. Yeast is not easy to deal with. You also need to look at diet, because your child might be eating things that are at the same time as you're trying to control it with nystatin, you might be eating things that are increasing it. So you want to make sure that you balance everything out for yeast. And if you haven't, I think Julie Matthews, who's been on our show and is
She's
about
on
to
next
come.
week.
Yeah, she talks a lot about yeast, and she's
And
very, very
diet.
good. And die-off. So die-off can go on for a long time. It can be very short. It depends on the child, the level of yeast, what's going on, the treatment.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.